My name is Benji Canales. I graduated from Louisiana State University in New Orleans with my medical degree and master's in public health. I then completed residency and fellowship training at the University of Minnesota in Minneapolis. I am a minimally invasive surgeon of the kidney and ureter, which means instead of making a big incision to look at those organs, I go inside with little scopes. So either the inside or the outside of those organs. The majority of my clinical practice is at the Gainesville VA. I do all the percutaneous kidney stone procedures there, as well as all the laparoscopy for both cancer as well as benign conditions like obstruction. I'm really passionate about kidney stones. 80% of the kidney stones in the United States contain calcium and oxalate, and it's that second portion, the oxalate, that I really study. Oxalate is found in a variety of foods that we eat on a daily basis, anything that's from a plant or a plant derivative, so peanuts and peanut butter, almonds, chocolate, spinach, tea, all those things have oxalate in it, and of course we're always ingesting it. A good portion, about 30 to 40% of people with calcium oxalate stones absorb too much of that oxalate from their diet. And that's what really our research interest is in. There's specifically one patient subtype, and those are patients who have had the weight loss surgery, the gastric bypass surgery, that absorb 3 to 4-fold the amount of oxalate from their diet. So we have a research model here that we're studying to try to figure out why, and not just why, but then what can we do about it, what kind of interventions and maybe even therapies to help these patients to lower their stone risk for the future. The other thing that our lab is doing is developing almost like a dipstick test so patients can monitor their oxalate levels at home. As it stands, the only way to really monitor your oxalate is to bring some urine into either a clinic or a lab to have it tested. And I think if we could empower patients to do this at home, it'd be a really powerful way for them to see what their own diet is like and find out how they themselves as an individual can lower their oxalate levels. I came to the University of Florida because of the outstanding research that's done here. I think this is reflected in its national standings, in the NIH dollars, and just the amazing faculty that are here. The two researchers that I work most commonly with, both are full professors and both are basically world experts in what they do. One is Dr. Saeed Khan, who does oxalates research. The other is Marguerite Hatch, who actually studies the transport of oxalate. So again, in line with my research, these people they do experimental research, and then I can bring in the clinical side, and it really makes for a powerful combination. It also didn't hurt that the University of Florida Urology department has an amazing cast of oncologists, reconstructionists, and of course my partner, Dr. Vinnie Bird, who does stone disease as well.